It's 23 minutes away from 8 o'clock. Good to have you with us here on eNCA. I'm Gareth Edwards. Now, children have been largely ignored in government's response to the COVID-19 pandemic. UCT's Children's Institute says it's time their voices are heard. It's calling on government to make a concerted effort to look at the needs of children. So how have they been ignored? What are those needs and how do we fix that? Well, let's now speak to the Institute's Laurie Lake. Laurie, good morning to you. And just help me understand, when we say a statement like government has largely ignored children's needs during COVID-19, just as briefly as you can, what do we mean by that?
One of the key considerations when COVID arrived on our shores was to prevent the spread of infection and to obviously treat patients and to flatten the curve so that hospitals weren't overwhelmed. And at the time and even now, COVID is considered to be primarily an adult disease. So our orientation was very much focused on adults, even within the health service. Routine health services for children were scaled back. Pediatric beds were diverted to adult COVID care, all to enable the health system to cope with the surge. But that has led, for example, to a 23% decrease in primary healthcare visits for children under 5 in the Western Cape, with significant impacts on testing and treatment for HIV, TB, malnutrition. And those kinds of effects are profound, both for children in the immediate term, because children are so vulnerable, particularly when they're very young, but also because those kinds of impacts are going to carry across the life course for years to come.
Yeah.
And then if we're looking beyond health, we've seen how unemployment has driven a massive increase in child hunger, with 1 in 7 children or 1 in 7 households reporting that a child went hungry in April. So
what are we looking to get from government if we look a little bit further down the road, Laurie? Laurie, I'm wondering if you can hear me. Let me just ask the question again. So, as you quite rightly say, this is going to be a problem for children now for years to come, as they become adults as well. What are we hoping to get from government and organisations that can make a difference? What are we wanting from them right now to make it better in years to come?
So the first thing is we want to make sure that there is no regression. The High Court in Gauteng ruled that government may not roll back services that are already in place. And that was in connection with the National School Nutrition Programme. So government has a responsibility to uphold children's entitlements to things like basic education, basic nutrition, basic healthcare services, and those need to be sustained and maintained and restored if necessary, so that children have access to the supports that they're entitled to. It's equally important to put additional measures in place to make sure that no child is left behind. If we're thinking about measures to ensure that children are able to access healthcare, we need to be thinking about children with disabilities so that they don't land up with long-term additional costs to both their health and to their learning. We need to be looking at the gap in terms of the digital divide and e-learning in schools. So we've seen how the pandemic has really deepened the divides in our society, and we need to be building back a whole lot better. Equally important, we need to be keeping an eye on the child. We need to strengthen our surveillance systems in health, in education, in ECD programs, so that we're identifying those children who are in need of care and protection. And that includes what is happening to children when adults are admitted into hospital, because we know globally that COVID-19 is increasing orphaning rates.
And this is where the problem's coming in, isn't it, Laurie, as well, where we've been all so focused on paying attention to the vaccinations and how to treat the adults who are getting sick. But I think we have forgotten sometimes just how this affects young children as well. Laurie, I need to say thank you for the moment, but it's been a wonderful conversation, and you're bringing children back into the spotlight, quite rightly, where they should be as well for years to come. The young generation of now is going to be dealing with the fallout of COVID-19. Hopefully not too much from a tragic perspective of losing parents, but as Laurie Lake from the UCT Children's Institute says, we need to bring children back into the spotlight and make them once again a priority. My thanks to Laurie for joining us here on eNCA.